How long has this been going on?
I initially hurt myself in 2015.
What happened?
I was at a birth and the mom, we were like in a space about this big and she passed out walking back to the bed and I caught her, but I couldn't like squat, so I just caught her in a dead drop and I just
your low back
fell down.
It never hurt prior to 2015? Never felt anything?
No, I was in really good shape. I worked out like crazy.
Was it keeping you from wanting to work out, obviously?
I've gained 60 pounds since I hurt my back.
Can't do anything.
I can't. I even like hired 2 different private personal trainers who tried to work with me and they were like, we can't do it.
What was Brian doing with you for your back?
We started just kind of with like the routine stuff and then
like
it got
side,
we were doing side posture and then that was making it inflame worse, so we stopped doing side posture and then Spencer started working with me and doing drops.
Okay.
And like some stretching.
How have you done with drop?
Better, but now this hip thing is like insane and nothing's helped it.
Initially it was low back.
At
what point did your hip get involved?
It just started last week. I had a moment.
Really? You haven't had any hip issues until last week? Really?
I've had like sciatica that runs through.
But it's not the same feeling.
Oh my God, it's totally different. I've got IT band issues.
Since when?
I think I've really always had it. But
it was tight?
Yeah, oh yeah, for sure.
Did you do sports in high school?
Oh yeah, everything. Volleyball, cheerleading, I played basketball, I was
Did you ever get knocked out or have a good neck injury or anything like that?
I also broke my 5th metatarsal last Thanksgiving. I just, fell down some stairs gracefully. Maya was Facebook Living it.
So, you fell downstairs. Talk to me about that.
And my foot I slid. It was my mom's front steps and they were wet and I slid and my foot rolled.
Exactly?
It was the week before Thanksgiving.
And no history of trauma that you can remember?
No.
Okay.
Well, okay. You know what? That's not true. And I've never thought about this.
Usually there's something.
Almost 18 years ago, I was in a rollover accident.
There we go.
I never even thought about it.
Well, I don't have to look far for traumas.
Never thought about any of that stuff messing my back up. That seems silly.
Let me have you sit on the end of the table.
Okay.
I'm going to take a look at your posture overall.
Okay.
The hip's been in the last week or so.
The hip's like a 9 to a 10.
The day-to-day, your back is...
Day-to-day, 6, 7. Every day.
When you have flare-ups, it's
through the roof. Like I literally...
How often does that...
I literally probably 3 times a week can't dress myself. Like I can't get underwear or pants on.
How long have you been doing this kind of deal?
Years,
huh? As best as you can, try to let go of the legs. Good. I know that's tough because you're guarding, but you're doing good. I noticed that right side's pulling up. Do you notice more of that tension on the right side?
Yeah. Oh yeah, for sure. I've been having like intense brain fog all week too.
I bet. You know about nociception, right? Like the pain signals? Has a tendency to override normal cognitive thought. Check this out. Right there.
Oh yeah, no, I feel it.
It should feel like how the left side feels.
Yeah. I actually said, it hurts right there.
Yeah. That's your C2 dorsal root. Yeah. Basically the skull, atlas sits right in that little soft spot.
Yes.
C2, it's like right there.
Oh, okay.
What'll happen is the atlas will be displaced and it will put pressure on that nerve root right there. So between your posture twisting and then that nerve root being swollen, I can definitely tell you you're out of alignment and I can help you. And just visibly looking at you, try not to move, but you have left head tilt going on.
Okay.
So with that displacement, it's bringing the head tilting left. And then what your body does, your brain does this intelligently, is it will hypercontract your right side to draw the head and eyes level.
Oh, okay.
That's your new baseline. Even just like feeling your back, the right side is hypertrophic. It's larger. X-rays.
Helps good.
Come on back. Baby scoot to your right just to drop, so you're right in the middle of the chair. Exactly. Arms up. Put the lead on it. Okay, just relax for me for a moment. I'll drop a couple lines here.
I love that you think I can relax.
As best as you, whatever that means for you. That's what I should say. When your atlas is out of alignment, your head is a 12-pound bowling ball. So when that tilts, your body mitigates that by twisting.
Yeah.
And it instantly puts abnormal pressure in different regions of your spine, primarily in the neck and low back. Right. And then through like the apex of your thoracic
Yeah, well now
spine.
I'm having thoracic issues, which is totally new for me too.
And so, if it makes sense, every visit you can come in and I can mobilize those areas and you'll get relief.
Right.
But if I can correct your atlas, I shouldn't have to do that all the time.
Right.
We're getting a three-dimensional view of where the structures below your skull are at.
Okay.
Because we have your skull symmetrically captured on the front.
Look at my nice straight neck.
Okay, so this is the series that we are looking at to get an overall picture of. I know where your skull's at, where are the structures below the skull. Atlas, C2, cervical spine. Basically, how is the body misaligned relative to the head?
Okay.
Is the idea. We have a window between the jawline and the back of the skull. And you'll see the column of your cervical spine coming up. That's your C2. And then resting on top of the C2 is the atlas.
Gotcha.
It will look like that.
Yeah. Okay, gotcha.
Yeah. So I'm going to measure, rotationally, how is that?
Gotcha.
That's one of the factors that's going to come into your misalignment pattern. Okay. From these two pictures, let me zoom in on the atlas so you can see it here. I will be measuring where's the skull at, but from this point of view, the atlas will look like a bow tie. So I'm going to measure from this view, how's the atlas tilted?
Okay.
So we'll know how it's rotated, like this, from that view.
And
How it's tilted from this view.
Okay.
And then also from this view, and using this as a secondary reference, and I can even just tell visually, looking at this without anything, that C2 is really rotated to the right.
Yeah.
All right, Jack will get you scheduled for next time. The biggest prereq is that you have, one, about an hour and a half to be here.
Yeah.
And two, you have the rest of the day to take it easy.
Oh, okay.
Your C2 is rotated so much more.
Yeah, I had just told you 2 days ago. I was like, right there, and he's like, that's your C2.
Yeah, it's crazy rotated right. So like her C2 spine should be rotated away from her cervical spine.
Yep.
She should have a high plane line, which she does. Her AFP is 8. And then she should have anterior rotation in a contra pattern. So everything is typical.
Sure.
If for some reason like her C2 was way rotated left, or her atlas was rotated posteriorly,
then it would be
that's an atypical factor that I would really key in. So, from an advo standpoint, what I'm going to do is take the shoulder that's on the table, that left shoulder.
Okay.
I'm going to drag that inferior. Drag it right. Her left shoulder is going to be going inferior to take that contra out.
Okay.
Right, so I'm prepping it to release instead of me trying to influence it.
Sure.
Cool?
Yeah.
And then I'm going to take that distal shoulder also, I'm going to take it left. And once I go dink, 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 and I get enough drag in there, it's going to take that C2 with it as well because of the facets.
Okay.
So I'm going to be influencing that left. And then I'm actually going to use the headpiece to open up and influence her atlas, actually to tilt it up slightly, to squeeze her atlas on the proximal where I'm going to be, posterior just a little bit. Because the shape of the atlas is a wedge, so the anterior is going to be tighter.
Okay.
So if I can approximate that skull in C2, it's going to squeeze and push atlas posterior. Like documents everything, it's amazing. So she's going to be going inferior. I'm going to take that thing left, that shoulder is going to go towards the left to account for that C2 rotation. Her head, I'm going to have the headpiece a little sharper on the angle to start and tap it just a hair up to initiate that head tilt and approximate that joint. But not so much that I destabilize her mastoid.
So
like I wouldn't do something like this.
Right, where it's really
Because
flat.
especially with her, if you look, her mastoids are very round.
Okay.
So she's going to need a little bit sharper angle than the average bear.
So you're able, with your table, you're able to do most of the influencing before you even. Okay. Cool.
Exactly.
That's
I will
not
set
even a
her.
nice table.
What I will do is set her up in what we call neutral spine line, and then from there I will influence. So the first thing I'm going to do is get her down, make sure her mastoid's secure, and then from there establish for her neutral spine line, and then start influencing based on her misalignment.
Okay.
And then the last thing that I will do once she's prepped and ready to go is set the instrument up based on her listing. Legs up on the table. I'll slowly dial you in here.
Okay.
Get you right where I want you to be. Just let go.
I don't know how to do that.
I can tell. So I'm stacking one mastoid on top of the other, and then I have a little bead right at the center point on the headpiece. That's where I want her to end up. Just let go. Her hardest part is going to be letting go on this, because she's tight. C7, T7, and EOP. I'll line those guys up. She's a little high to start, but she's going to end up at 8. So instead of dropping her down to put her back up again, I'm actually going to leave her up there. Maybe drop her here, since I'm going to be dragging that shoulder inferior. Because that's going to cause that head to be a little higher as well. So she's sitting on a 17. Alright, Doc, what's 34 minus 18?
16.
So that's what I'm going to set the instrument up to. Our rotation's an A1. Which I swear, lately I've been sort of noticing sits right on where earring holes are. I don't have a good answer for why, but... So her transverse process is almost halfway down her mandible from her mastoid. But she's a really high angle. She's 33, so I'm going to start in her ear, actually. Her transverse, so that's her mastoid. Her transverse is going to be right about there. So I want to be in front of and enough lead for it in terms of rotation and height. All right, last thing, I just want you to let go of that head.
Okay.
Beautiful. Good job. I'm gonna bring this arm up onto my shoulder.
Okay.
Get a grip on me. On the count of 3, we'll come up. 1, 2, 3. You're gonna put your feet on the floor. Good job. Don't move that head. Amazing. You got a good set.
I can feel it, like the difference when you have my feet. I don't feel as stuck.
I'm not pressing quite as hard, but that nerve root's not swollen.
No, it's like not tender at all. Oh, this is attractive.
Looks good on you. You really pull it off well. Come on down.
Yeah,
Got a little more work to do.
I am, like,
When she goes
tired.
out again with her C2, I can just tell visibly without lines. And then her cervical spine angle. It's going to need a little more work.
Yeah,
But I know she got a good release physiologically by that nerve root in her leg check. Go rest.
I know, I'm like, I need a nap.
You feel kind of, I hear people say they'll feel stoned.
I do. I feel like I don't know what to do with my body right now. Just and like today, I felt it when I woke up this morning, but I was feeling better for sure.
So what did you notice with the adjustment?
Well, I didn't realize how uncomfortable my neck actually was until it felt really good.
Right on.
And then definitely not as tight. Like this morning when I woke up, I felt myself tight again. So I was like grateful that my appointment was today, but I was so much better all weekend.
Does it feel like the same kind of tightness, or more like things are just kind of guarded because it's new and weak?
Today in the hip, it feels like it was feeling before. Everything else just is, yeah, and because of that, I'm guarding again, but it's definitely different and better
Same
overall.
level of pain in the hip though as that day you came in?
It's pretty close.
Pretty close.
Pretty close.
Same quality to it, like same spot, same ranges of motion that you're feeling it.
I don't feel it as much on that outside now. I am feeling it more in the butt, kind of like the sciatica type thing, but definitely still the hip.
That's why I'm curious if it's kind of centralizing. You know about
Yeah,
that, right?
yeah.
Peripheralization, centralization. Yeah, that's what I'm curious. Because I like to see when it's not going down as far. It's heading more towards midline. Cool. Overall, did you notice like your posture, your body, like energy levels, sleep, that kind of stuff was any different?
I definitely slept better. I didn't sleep good last night because it was like school today.
But obviously, like there's still irritation that's on the nerve
Yeah, for sure.
that has to come off. But so you're aware of
Yeah.
It'll be.
We did a lot of like running errands yesterday to prep for school.
It's not that you're necessarily out. I'll check you.
Yeah.
But it can be that you're starting the process
Just
of cleaning
my body.
So your nerve root's not swollen. I wouldn't adjust you.
Okay.
So I agree. You probably just overdid it a little bit, a little too soon.
Yeah.
You can hang in there. Yeah, I wouldn't mess with it.
Yeah, it feels good.
You're good.
I wondered
Cool.
because I've been sleeping on
I
the
know.
couch and stuff. So.
Yeah.